Okay, Jonah. This is patient assessment, medical, psychiatric / behavioral.
Okay.
You have 15 minutes allotted time.
Okay. Be assigned as my scene safe.
Yeah, your scene is safe. So you are dispatched for a police assist. No other information was given at this time.
Okay. Well, now that I might be assigned my scene is safe, I'm looking at my MOI and NOI for this patient. What is my nature of illness?
The cop comes up to you, says that they had a fight with the patient. He got tased twice.
Okay. This is my only patient.
This is your only patient.
Okay. I'm going to also look at C-spine precautions for my patient as well. I have my NOI, which is he was tased twice by the cops, and I'm also going to call for additional resources if needed.
Okay, so the cop says that it took a whole gang of them to put him in handcuffs and put him on the ground. He had like superhuman strength. He's been talking crazy. They came out here because he was out in the middle of the street, naked, just dancing around.
Okay.
You find the patient laying left lateral recumbent in handcuffs. Is there anything else you'd like to know with that?
No, my general impression right now is that I have a patient sitting in front of me. He has been restrained at this time. I'm going to assess my airway, breathing, and circulation. Is my airway clear and patent?
Your airway is patent. Breathing is rapid.
Okay.
Pulse is rapid. And as you touch the patient, his skin is extremely hot and non-diaphoretic.
Okay.
And his mental status, he's just open mouth screaming at you.
Okay. Okay. All right. Well, I'm also, since I already assessed like my skin temperature, I'll always keep that into consideration for my patient as well. Same thing with the rest of the vital signs. Right now, just because of his tussle with law enforcement, I am going to opt to stay and play at this time, just so I can get further information from law enforcement and the patient as well. Does law enforcement have any additional information?
They know that he's a pretty heavy drug user. He has multiple run-ins with the police. They don't know what he took today, though. They've never seen him act like this.
Okay. Is he feeling pain anywhere at all?
He isn't making any sense when you ask him any questions.
Isn't making any sense. Okay. Well, I would ask like OPE, QRST as well.
So the cops say that he's been out in the middle of the street for the last 10 minutes before they arrived, and they had been on scene for 30 minutes trying to wrestle him in the handcuffs.
30 minutes. And there was no apparent like scrapes, bleeding, broken bones, or anything that they noticed?
No apparent life threats that you know.
Perfect. I'll also move into a sample history as well for my patient, see if there's any signs and symptoms of maybe anything going wrong. I'm going to look at his pupils.
They are pinpoint.
Pinpoint, okay. I'm also going to see if the cops knew anything that he might have taken, his last oral intake.
They don't know if he ate anything, but they do know they've been to his house. He doesn't take any medicine.
No
has
allergies.
no allergies.
Okay.
And other than being a pretty heavy drug user, he has no other past medical history.
Okay. I'm going to get a full set of vitals or have my crew help me get some vitals.
Okay. So your first set of vitals here, you have a pulse of 120.
Okay.
Blood pressure is 190 over 120. His respiratory rate is 34.
Okay.
Any other vitals you want?
Might as well get like blood sugar and temperature.
Okay, blood sugar is 88 and his temperature is 99 degrees.
Okay. All right. I'm going to also ask law enforcement if they are going to keep detaining him for any reason, and if we're opting for transport to the hospital, I'm going to make sure I have law enforcement ride with me.
Okay. They're going to keep him on a PC hold.
Okay. Perfect. I'm also going to assess just the rest of his body systems as well. Just make sure I can assess like his pulmonary system, cardio system, just all that kind of stuff as well.
Okay,
And
so the
also
cardio
neurological
system,
assessment.
neurological assessment. You
Mhm.
don't notice any facial droop.
Okay.
No slurred speech. Equal strength in his arms. You can tell from his handcuffs. He's still kind of thrashing around on your stretcher.
Okay.
Did you say cardiac?
Yeah.
Okay, so you're doing a 4 lead or a 12 lead?
You're 4 lead.
4 lead, sinus tack.
Okay. Okay. And he hasn't thrown up or had any sort of nausea, vomiting, anything like that yet?
Not yet. His skin temperature is still pretty hot, and he's kind of dry heaving.
Okay. Well, I'm always going to take into consideration of keeping his airway protected, so I will use maneuvers, either rolling him onto his side or sectioning whatever I need. Just make sure that airway is clear if he does produce any vomitus. I'm also going to, since there are pinpoint pupils, just kind of help him chill out as well. I'm going to give him a little bit of Narcan as well.
How much Narcan?
0.4.
How do you do
0.2
that?
to 0.4, and it'd be IV push is what
Okay.
I'd be doing. I'd start with 0.2 and then just work my way up from there.
Okay, he vomits on you.
Okay. I'm going to make sure that his airway is protected. What are the? I'm going to reassess my patient as well. Can I have a reassessment of any of his vitals and stuff?
Yeah, his pulse comes down to 100, respiratory rate is 22, blood pressure is 140/90, temp is still 99,
Still 99.
and he's still combative.
Okay. Still combative. Well, I'm going to keep Narcan on board just because he's a little bit warm. I might have some fluids running as well. I'm going to kind of help him chill out a little bit. Also take into considerations that he has used other drugs. I'm going to opt into using ketamine for this patient as well to help him chill out a little bit. I'm going to give him 4 milligrams of ketamine per kilogram, and I'm just going to see how that does, making sure that I'm watching his airway.
What route are you going to give that?
IV
IV?
or IM.
Okay.
Okay.
Okay, he's in his ketamine nap.
Okay.
He's not combative anymore. Vitals are starting to come down. Pulse is still 100. Respiratory rate is 18. Blood pressure is still 140/90.
Okay.
His skin is not as hot as it was.
Okay. My field impression of my patient is that he was having some sort of agitation, most likely from some form of drug that he was taking. I'm going to make sure that I'm going to transport this patient as well. I'm going to make sure that I'm reassessing his vitals every 5 minutes since I gave him ketamine, making sure that I'm just protecting his airway, breathing, and circulation en route to the hospital.
Anything else you'd like to add?
No.